been doing this now for about 37 years, and I used to be of the mindset early on that there were these kinds of James Bond scenarios that would never happen, and that was the case. Early on, that certain kinds of technology, wouldn't get impacted. But now, after certainly in the last decade, anything with technology, frankly, is unfortunately is vulnerable.
If you look at a hospital setup or the healthcare setup in a more broader perspective, what you see is a labor-intense organization that is using sector-specific, highly regulated digital assets with numerous interaction between the individuals, between the units, between the wards, between departments, between external physicians, and there's a long list. If I look at this with some sort of attacker's mindset, that's my perfect background. They have tons of responsibilities. They are considered a critical infrastructure for the society. So if I am looking for something where I have a high chance of being successful, and I also have a good chance of getting my money compared to other sectors because of the criticality of the sectors.
The most common, unfortunately, is ransomware right now. And it's not that hospitals are being targeted sort of specifically. The attackers are not saying, hey, we're going to go attack hospitals. Instead, it's going to be, here's some vulnerable machines. We can ransomware those. That's the most likely one. And again, because of this complex IT environment, it's very easy for the ransomware attackers to move laterally. Phishing is almost always an entree into a ransomware or other attack. So to get that initial sort of ransomware deployed, phishing is going to be one of the steps that's going to be done. And additionally, with the use of, this is where AI is really being used by the attackers, is making much more legit, much more believable phishing emails or messages.
The first priority for them is patient care. It's not cybersecurity. But in consequence, when you build up a layered protection model that protects yourself and your patients from cyber attacks, the role surgeons and leadership in hospitals, in a hospital environment can play is to make sure that the medical processes that should be protected are understood by the cybersecurity guys whose role is to protect these processes, the digital assets supporting the processes.
I think also talking to colleagues about it, there's so much sharing already going on, but on some of these topics, it's not something typically the core of their day, but just saying, hey, what's going on, with the security in your environment, cybersecurity with you, and all the stuff that you're dealing with. Fortunately, that there's so many common tools being used, such as Epic and others, that it's easier to have those technology discussions. And I think that there's so much technology going on now for the current student crops that are coming in, that this is going to be more common. So I'm pretty encouraged.